I think the most exciting thing here is that we would be able to take an employer that really couldn't make it work under a fully funded plan and make it thrive under an Andel program.
You're listening to the GLP-1 Studio Podcast.
Has your employer recently cut your GLP-1 coverage? Or maybe they've never covered it before. I have spoken with countless patients who say the same thing. Losing access is absolutely traumatizing, regardless of how it happens. And yes, they would leave their job in a heartbeat if it meant getting coverage. Well, the good news is you may not have to. Today's guest is Jay Bregman. He is the founder and CEO of Andel. Andel is a healthcare technology platform that allows high-cost prescription medications like GLP-1s to be accessible through employer benefits. Jay is a serial entrepreneur with over 20 years of experience with building and scaling companies across mobility, insurance, and healthcare. He has successfully exited 3 companies, including Halo, now known as Lyft Europe, and Thimble, which was acquired by S&P 500 insurer Arch. Jay is leading the development of an employer-supported medication marketplace that is improving access and affordability to GLP-1 medications and other breakthrough medications. All of this to say, Andel helps employers offer these drugs as a workplace benefit for their employees at a more affordable cost. And the best part is you don't have to wait for your employer to find them. You can go to Andel's website and refer your company. But I'll let Jay take it from here. Enjoy listening.
I'm Jay Bregman. I'm the founder and CEO of Andel. I've been an entrepreneur my entire career, 20 years. Started out in London, right out of grad school, built and sold 2 businesses in the mobility space. The second was the first pan-European ride-hailing company that became Lyft Europe. Then I came back to the US after 12 years, started a property and casualty insurance company called Thimble, which was all about trying to create a better experience for freelancers and micro business. After 7 years, we sold that to Arch, which is an S&P 500 insurer and reinsurer based in Bermuda. And after that, I wanted to do something really big and felt I had earned it. And my entire family is in medicine. My dad was a heart surgeon. My mom is a CRNA, even today in her 70s. And so I always wanted to do something in medicine. I wanted to solve the biggest problem in healthcare, and I think it's brand name prescription pricing and distribution. That's why I'm here.
So you've got a whole lot of healthcare in your family then.
Absolutely. It's not just my parents. It's kind of all of my extended family as well. I guess I'm a little bit of the black sheep.
Well, you're out there doing wonderful things too, just in your own lane, right? This
Well,
is
yes,
certainly
yes,
unique.
but you always come home, I guess.
Yeah, that's so true. Tell me a little bit about your history and deciding that this is what you were going to do.
Well, look, I had always wanted to be an entrepreneur ever since I can remember. When I was growing up, when I was at Dartmouth at school, 97 to 2001, it was really internet, the 1.0, right? It was eBay, Amazon, they were all, being built at that time. And then, I had thought for a while that I wanted to be a lawyer. And then I actually got a job as an internship at Harvard Law School. And I talked to all of the lawyers, and it turned out that all of the lawyers wanted to be entrepreneurs, and they really dissuaded me from being a lawyer. And so I decided that I would just go into being an entrepreneur.
Amazing. Okay, so how did Andel get started then? Where did this idea come from?
Yeah, well, I mean, look, I was sitting around, watching the Bernie Sanders hearings on drug pricing, where he hauled in all of the heads of the CEOs of Novo Nordisk and Eli Lilly and Sanofi and other pharma companies, and also the CEOs of CVS and all of the other PBMs, et cetera. And everybody's screaming at each other and nobody's really taking accountability. And I just thought that there was something that was wrong here, right? Like the market was $850 to $1 trillion in the United States, growing by 10% a year. And it seemed it was sort of medievally organized. And I just thought that maybe I had earned the right to try and do better.
Thank you for doing that.
It's
Um,
not over yet.
s- so we're only just getting started. I think you just started a partnership with Eli Lilly. Is that right?
Eli Lilly, yeah, it's a fantastic company. We are working on their Employer Connect program so that we can sell a new presentation of Zepbound called the Multi-Dose Quick Pen. And we can sell that in a way that allows us to sell it directly to employers, where employers are contributing a portion of the cost, for the product to help basically reduce the burden on employees, but also to provide a way that employers might support and sponsor employee usage without having to commit to putting these drugs on the fully funded plan where they can become very, very expensive. And sort of, the program to me, when I heard about it, I really just jumped in my seat because I thought, wow, this is what I've been trying to build. And I'm so excited to be able to be a part of this.
So what is the mission statement for Andel then? What is the core mission?
Well, look, Andel is built around the word Andel, which is a word in Danish and Swedish that means a share or a part. And it refers to these ultra member focused cooperatives that they have in Scandinavia and have had for hundreds of years. And I thought, wow, like if you're going to solve this problem of putting together employers, employees, and pharma manufacturers in a transparent and efficient way, why not try something totally different, right? A cooperative technology platform that, using technology, automation, and AI, could allow us to basically put those three together in a marketplace that was as efficient as possible with as little corporate overhead as possible. So it really did look like a cooperative from the outside in. I was just intrigued by that concept that maybe this was the way forward.
I had a very similar idea. I just met with the Obesity Action Coalition last month, and we were trying to figure out a way that we could get this medication in the hands of the people who need it, the brand name medication, and that at an affordable price. And I racked my brain for a couple of weeks and I thought, this exact program you've created was the answer. And so they looked into it and they only found you. They found Andel as an organization who was doing exactly what we were thinking. And they were like, oh my gosh, I've got to contact them. How do I contact them? That week, Olivia reached out to me and asked if we could get you on the podcast. And I was like,
Mm.
this is the universe in action right here. So we had to hear all about Andel. Are you planning on organizing your program around other obesity medications or other medications in general as well? Or are we just working with Eli Lilly?
No, absolutely. I mean, we're in, and it's not just obesity medications, but I'll explain that in a bit. I mean, so we are talking to every major current and future pharma company and biotech, right? That is producing medications now and in the future about being part of their launch. Ultimately, we want to host lots of different products because when you deal with employers, they don't really just want one solution. They would ideally like a variety of solutions that might suit different types of their population, that might have different requirements. They might want, might have different, the side effects of the medication might affect them in different ways. So that's important. But what's also important is I realized very quickly in speaking to customers that they didn't just want this to stop at GLP-1s, that GLP-1s were opening the door to something much bigger. So what I would hear consistently from CFOs and consultants and brokers is, Jay, this is great that you can solve this problem for GLP-1s. It's a massive problem for us. But here's the list from our claims report of the 10 biggest drugs that are weighing on our pharmacy spend. Can you go and negotiate similar deals with these other companies and put them on your platform such that we might be able to support our employees with them in this parallel pathway in a similar way and get access to a transparent price, perhaps that was lower than what they were paying otherwise, and much more flexible as well. So I think this is really a wonderful thing that really is just having a moment right now in terms of people are very open to the idea that doing things the way they've done it for the past 50 years is just not working. And so they, out of necessity, people now need to look at these new and different solutions for certain types of drugs that are a good fit for this model. Now, we don't want to replace all of the existing infrastructure. There will always be PBMs of some sort. That's totally fine. But we think that there is going to be a new slice of the market that's going to be quite substantial for companies like us, maybe just us.
Would you agree that GLP-1 medications and GLP-1 patients and entrepreneurs like yourself, that we are changing the healthcare system in general?
Well, yeah, look, absolutely. I mean, I think that these medications themselves have dynamics that have never been seen before. These are highly preventative medications. They apply to a wide swath of the population, 60, 70, 80, maybe 100% of the adult population when you add up all the indications at the end of the day. And they need to be taken indefinitely because they're dealing with chronic conditions. That was something that never happened before and really the healthcare system has never had to confront. It's also quite a sad fact that pharma, up until this point, really has had no incentive to produce drugs like this because there's been no direct to consumer, there's been no direct to employer, and the fully funded benefit is just not a good place. Insurance is not a good structure for supporting these kind of medications. And so, it's great because it's effectively breaking the system. And my hope that when Andel is said and done is that the incentives for pharma companies will be to produce highly preventative, highly scaled medications that apply to diseases that are broad in scope, as opposed to just going and solving a problem for smaller and smaller populations. This very small, cancer, this is a very small type of gastrointestinal disease. Why not solve the entire category, right, at once? And I think that's just really exciting to think about what might happen in the next 10, 20, 30 years.
You've heard of Mark Cuban's Cost Plus program, correct?
I think everybody on the planet has heard of Mark Cuban's Cost Plus.
So he kind of broke the mold himself, starting that program where you can get medications at the list price rather than going through PBMs and insurance. But you're starting something, it's not the same, but it is the same in that it's completely new, right? This is something very exciting, and it is a new way to make these medications affordable and go around the PBMs, but without having to pay that list price, because that's really not helpful when it comes to a $1,200 list price, right? So we have to get into pricing. People are going to want to know how much their employers should expect to pay, how much the employees should expect to pay, and if there are any sort of discount
Yeah.
incentives for employees, insurance, or employers.
Well, look, I think that's the key difference between us and Mark Cuban and everybody else in the market. We were born to solve this direct to employer problem first. And we believe that in order to solve this problem, we needed to create a new kind of entity and new kind of structure that was so technology enabled that it could not have existed even a year or 2 or 3 years ago. It had to be purpose built for this. We had to create our own non-dispensing pharmacy, our own pharmacy management system from scratch, no legacy, no other systems involved. We had to create our own native applications, our own interfaces into employers. And we had to create all of the AI and automation around all of those things, because I think in order to really do well in this market, you need to provide a real edge to employers. And that edge, in my opinion, is every dollar that they spend is a dollar that goes to reducing the cost of the drugs for their employees, not into our pockets. So the way we've structured our program is, it's only less $9.99 per fill. And basically that can be paid either out of from the employer, out of the contribution they receive from the employee, from the employee, out of the contribution they receive from the employer, or from the employer directly. But there's no administrative fee. That's it. There's no administrative fee. There's no PMPM. There's no telehealth fee. You don't have to have a clinician team that does it. You can use any prescriber, right? This was designed to be the sort of solution that was just a no-brainer. We have absolutely the best experience of anything out there on the market, and it's the lowest price. Try and say no to that in this environment, right? And that's just, again, the reason other companies can't do that is because they built themselves to be either a slightly different, totally different model, or they're just too top heavy to basically sustain themselves on such a small, relatively small amount per fill. When we believe that through technology and through automation and AI, that is possible. And actually, we can get the cost perhaps even lower in the future, which would be great. And that's this whole cooperative spirit, right? Which is we're not trying to basically create a massive money-making machine. We want to create a big business, don't get me wrong, but we want to create a big business that basically, that changes the world and changes the incentives. And we want to create a marketplace that ultimately has, tons of scale, but, we don't need to do that off of the backs of the employers.
Yeah, thank you. Um, so what I'm assuming that the pricing is varied by company and the amount of employees they have. Is that right? Or is it the same across the board?
No, it's the same across the board. And that's something also that the smaller companies and the larger companies think is really fair. Because ultimately, when you think about these medications, it's unclear why in a totally automated self-service type environment, why it would make any difference, right? Why there would be a larger fee for a larger company, except that one might think that the larger company had deeper pockets and had more to pay. Our philosophy is the larger company will have deeper pockets and therefore have more left over to support and sponsor their employees by paying more of the drug cost than perhaps a smaller company can afford to do. And that's fine, but we shouldn't get in the way of that.
And so we have to make sure that this is super easy for people to understand. If they are an employee and they want their employer to be on this program and they want to be a part of it, what does that employee do?
Yeah, so they can go to our website, and we have a refer your employer form and section already, where basically you can go on and you can basically put in the details of your HR manager, and then let them know about this program. And we believe that that will be a big source of our business in the future, because awareness is, of course, is a big big part of all of this. And we don't want to spend a gazillion dollars on marketing, or on ads and things like that, because again, that's money that we could have spent on our product and our service. So yes, I mean, but if they are eligible for this program, their employer will let them know, because they will let them know that this is a benefit that they're providing, like any other employee benefit that's out there. Even though this is technically not on the on the fully funded benefit, it's sort of like an off benefit. Um, and then the employees will be able to register, download our app, which is available on the App Store and the Play Store. They'll be able to verify their eligibility just simply with some very simple details, and then we'll know at that point that they're associated with their employer, what their employer is going to support them with, and then they'll see instructions for their prescriber to send the prescription to the Andel pharmacy, and then bang, everything is just automatic, right? The prescription comes through us. We have an interface with SureScripts directly, which is the e-prescription network in the United States. And then basically that prescription is triaged, is priced, and then we notify the app of the employee that, hey, they've got a new prescription. They go, they purchase net of the cost of the employer. The employer doesn't have to front any money. We take care of all of that for them. There is no pre-funding, no coupons, nothing like that. It's completely seamless. And then the employee gets their medication via next day UPS. It's that simple.
Wow. Okay. And so what could the employee expect to spend?
Well, so on our current program, the pricing is as follows, right? We're very transparent about this. I mean, like when I get a receipt from a pharmacy, whether I pay cash or I pay with insurance, I never really know what I'm getting, and I think that's really frustrating. And I was very, very proud that in this program we are allowed, and actually we are we have to display the kind of line by line pricing and fees for every step of the way. So you will see the price of the medication. So the list price is about $6.99, assuming it's a 10 milligram quick pen. It's $4.49 net price for every dose. So it's one price for every dose. There's a sort of dispensing and shipping fee, which includes all the cold chain, UPS overnight shipping, needles, et cetera. That's $55. And then there's our fee of $9.99. So that gets you to about $515, just a little bit less. Then you take away the employer contribution. On average, our employers are contributing about $100. So now you're down to four, and change. Some employers may want to do more than that. And so I think that's starting to be a really great deal from where we started with all of this, which is, hey, it's not covered, it's $1,000, or you got to go through all of these hoops. And by the way, there's no prior authorizations, there's no step therapies, there's no utilization management, all the things that really, really make doctors and patients, blocked from actually getting these medications in their hands. They don't exist on our platform. We put the prescribers directly in touch with the patients to make the decisions about what's good, for them and their welfare.
Okay, so what you're saying is that the employer may choose to make a larger contribution, which could then lower the price for the employee as well.
Yes, and it's actually even more dynamic than that. I mean, so you could have, for example, you could have an employer that has multiple states and basically has different contribution levels in different states. You could have an employer that wants to incentivize based on behaviors. So we have a project going on right now that we're exploring with a major connected scale company, where we could send that scale to every participating employee. And then if they step on the scale once a day for 4 weeks, doesn't matter what their weight is, just getting into that habit, that healthy habit of being able to be aware and do that, their employer automatically then pays a little bit more per month into their into their sponsorship. So there's just really intensely cool things that you can do, given this isn't insurance, and you're sort of you're in a new area of off benefits.
So that is super neat. I know that there are some employer like health benefit programs that already exist, but this is very interesting. Some people might hear that price and think that it is still very expensive. But what I think is really interesting is that I have interviewed so many patients who have said that they lost access through their employer because it was too expensive for them. And they were paying way more than $100, $200, whatever the employer has the option to pay now. Is there a insurance benefit for either the employee or the employer for being on this program, because essentially it's making your chronic disease, it should be hopefully for most people making their chronic disease improve. And so you would think that it would be like a smoking cessation program in a way, that there would be some sort of insurance benefit. Have you explored that at all?
Well, so absolutely, I'm trying. That takes a little time. I spent 10 years in insurance, so I believe very much in this. I believe there are workers' comp benefits. I believe there are life insurance benefits, and I believe there are health insurance benefits. The complication in America is, the average tenure of an employee is roughly 4.2 years, right? So in any given company, when the insurance actuaries or the kind of internal benefits staff look at the horizon of payback, they say, well, on average, this person's going to stay for 4 or 5 years. Is that long enough for us to see all of those benefits? Maybe, maybe not. I think there will be more data in the future. But look, it's not really about that. There is an immediate payback of this, which is productivity, which is employee engagement, right? Think of this as the 21st century gym membership, right? I remember growing up when I was, in the 90s and 2000s, when I was getting jobs, and they would advertise, we have all these great wellness benefits. You get access to the best gyms, and it's heavily discounted, and everything else. And okay, that's great, but this is something that is really a level above that, And you're getting basically access to these great deals, pretty much direct from the manufacturer. Plus, you're getting your employee sponsorship of this. So that's number one. Number two is I do believe that over time, employers, having seen the value of this, in their population, will be much more willing to continue to fund things like this, initiatives like Andel, to a deeper and deeper extent. It's just about getting to a point where that can happen. I mean, you have to understand that for fully funded plans, right? People that were offering this, employers that were offering this under a fully funded insured plan, that was like the average company, only 1.2 to 2.5% of the population was actually getting access because of all the utilization management, because of all the prior authorizations, so they were actively trying not to give this out. So there's no real great data at scale about this. And I think the bet here is, which I think is an easy bet, and I'll take it any day, is that not only for obesity, but for all of the other indications that are coming, down the pipeline and already have come, and some and are being studied, that this will be something that is just a no-brainer to offer your employees, and that your employees may look elsewhere for employment if you don't offer it. And I think that's really the key thing. And talent right now is, as it always was, is very, very scarce. So no one wants to have to replace people who are very expensive to replace.
That was what I was going to touch on next. I have definitely seen a survey somewhere where employees were saying, yes, I would leave my job and go to a different one if they would cover my GLP-1 medication. So you're absolutely right. It is a big incentive for people to move to a different employer if they're offering this sort of program. Do you know? Sorry, go ahead.
No, no. What I was going to say is, actually there was a study that was published 3 weeks ago in Obesity, the journal, which studied people who had been taken off. Their company had discontinued GLP-1s for weight loss, and it surveyed empirically the employees, and nearly 20% of them said that they would look for another job, and nearly 80% of them said that they had a negative perception of their employer as a result of that decision. So flip those around and imagine what happens when you start to provide a benefit proactively, right?
Yeah. Oh my gosh. I'm so glad that you brought that up. I did not know there was a new survey out, but I've interviewed with many patients who have lost access through their employers back in January 2025. In January 2026, it happened again. A lot of people getting kicked off of their programs or getting sent through fail first attempts or having to redo their prior authorizations and getting denied. And it is incredibly frustrating and truly life disrupting. People are on these medications, they lose their food noise. You're right, their productivity increases. Their there are so many benefits, including mental health benefits, right? And when you take all of that away, it's like I don't have words to describe. I've covered this before, but for someone who is actually on these medications, after you've started to go through these changes, your entire life changes. It's like a whole new life. And having that taken away is absolutely devastating. It's devastating.
Well, and I get it. And look, up until now, companies have, in a lot of ways, not had a choice, because they've been spending so much money having to buy these drugs through traditional reimbursement channels that they just could not legitimately afford to keep giving them out in any kind of fair way. The great thing about Andel is we give the employers a choice. And not only do we give them a choice, but even if they're a very small employer, right, and they just want to do something, right, they can get $50, right? Like, it doesn't have to be a lot per participating employee in the program. They can modulate, and they can actually increase over the year. So we have a dynamic program where basically employers can start out at a relatively low amount. Let's call it $50 per fill. And then as they see the program mature over time, as they get feedback from their employees during the year, they can go to 100, 150, 200, right? all there. So I think it's exciting.
That is exciting. Do you know, like, on average, what the difference in employer spending will be on this program versus what they were spending covering each fill through insurance?
Well, look, I mean, I think that the word on the street, and that's all you. The problem with the reimbursement channel and the PBM channel is nobody really knows. I mean, these rebates come through as a massive stream for all medications. They get one big check for everything. They don't get a check for each individual drug. Nobody knows, right? Even some people at the PBM don't know what that. What so well, we estimate it's, I don't know, $600-700 per fill that the employer is paying. So, that's 6-7 times what you could do starting out with a $100 contribution from Andel. That's just an amazing difference in how much you could spend overall, but also how many people you can touch with a program like this. Before you could touch almost nobody, and now you can touch, almost everybody if you wanted to. So, yeah, I think really what we're doing more than anything is we are empowering the employers with choice. They have the choice. It is not an all or nothing, black or white, opportunity for them. And basically, that means that they can provide structured and tailored programs that work for their specific business and their specific type of business. And that may mean lower amounts, higher amounts. It may mean dynamic amounts. It may mean more exotic structures that we haven't even thought about, but could potentially do. But that's, I think, the most exciting thing here is that we would be able to take an employer that really couldn't make it work under a fully funded plan and make it thrive under an Andel program.
What's wonderful about this is that I've interviewed with an employer once. There was a lot of heat on employers for, dropping coverage. And they said, I really want to cover this for my employees. I'm on a GLP-1, my daughter's on a GLP-1, several of my employees could benefit, and a couple of them are. I want to cover it, but it's not available on any of the formularies that are available to us. And so this would give them an opportunity to be able to cover it.
Absolutely, but also this is a wider issue, right? This is why we're getting so much enthusiasm from clients beyond GLP-1s, because there are an awful lot of drugs that right now are not on formularies that employees want and need. And basically, right now, employees do not have the choice. Those choices are made upstream by PBMs, by formularies, by their own employers, uh, about prior authorizations, plan design, step therapy, all this other kind of stuff. Well, my view is, why don't we just allow people to pay a price, a transparent price for every single drug that is available and FDA approved in the United States, so that anybody at any company, in America that's an employee, can get their employer to contribute at least something, even if the drug is not covered or not covered for them. And even if they're not contributing anything, at least basically we can link them up with this direct to employer price that is going to be a lot better for them than potentially buying it, direct, or at the list price.
Yes, absolutely. It seems like a no-brainer to me. I'm going to go back a bit because you touched on something that I think that we should cover. I'm wondering if you did market research. I'm sure you did too, a lot of market research, but I'm wondering if you did any on the price of gym memberships and what employers were spending on gym memberships on average.
Yeah, I mean, I haven't really, to be perfectly honest. I know. Look, there's a lot of. All I know is I've done some research on what employers spend on, mental health, wellness, writ large, and other types of services, and the answer is an awful lot. I mean, some of these services are pretty expensive, right? They can be, uh, dozens, up to 50, $100 per participating employee, depending on exactly what it is. Um, and seems like an awful lot, right? So, but again, those are very high. Those are kind of programs that are really generally very clinically intensive, right? So what we're doing is we're saying, well, look, that's great. We can do that if you want us to find a partner and we have partners that can help with the clinical side, that's fine. But actually, it's really not hard to find a doctor or prescriber that will prescribe you a GLP-1 anymore. Everybody in the country, let's face it, by now knows about them, has some degree of education about them, knows when to prescribe them, when not to prescribe them. And so the idea that you would need a dedicated telehealth team to do that just and pay for that just doesn't seem to make any sense anymore. And so we're just trying to kind of optimize things so that, you know, you're getting the company and the employees are getting just what they need. And in a lot of cases, what that is discounted access to the drugs and reliable access to the drugs.
Yes, I know that it's still early days, but I'm wondering if you've thought about pairing this service with any wellness programs as well. Because what people are getting from their telehealth clinics, this is a very competitive pricing, especially if the employer does chip in. What people are getting oftentimes from the telehealth clinics is full support services. So they've got a health coach, they have oftentimes a community support groups, they've got fitness and nutrition. And so it makes sense to me that if you could pair this with wellness offerings, that there would be some serious competition for the telehealth clinics that are offering this medication.
So look, I mean, of course we could do anything, but actually we want to stick to being really great at what we do, which is being this access layer for all of these different medications, starting with GLP-1s. And we want to partner with the best of breed services. So if we have an employer that comes to us and says, look, for certain types of employees, we really would like you to have some intense clinical support. We're in negotiations now with some wonderful companies, right? That I think will do a fantastic job that basically will really complement what we're doing and provide that best of breed where we're handling the amazing pharmacy layer, the sort of stripe, if you will, and then basically they're handling the clinical layer. And I think that's just fabulous. And imagine that all integrated together for not just GLP-1s, but potentially for other types of drugs and conditions as well.
This is fantastic. I love what I'm hearing. I'm wondering how much it would save these employers in the long term. I'm even thinking like if they weren't spending money building gyms and maintaining gym equipment, stuff like that, and paying for Weight Watchers, because I know that there are programs that they're paying for Weight Watchers and other weight loss or wellness benefits. I'm wondering how much money they could save just from having people being healthier, from being able to get this medication, from having their chronic diseases under control, because they're half of the country just about has obesity or overweight. And I know that I saw a report last year that said that the productivity, like you'd mentioned before, has vastly improved for employees on these medications. And I mean, there's less brain fog. People are able to show up. They're less sick, less often. And it really does make a difference, and it should make a difference in the long term. So I'm curious how you might track how much money employers are saving. It'd be really interesting to see some hard data a year or two from now from how much money employers are saving on average from what they were spending previously.
So look, I think the ROI is a wonderful question. And actually, the reason I say that partially is because we are, I'd say, in the middle stages of trying to negotiate a partnership with another entity, a really brilliant, well-known entity that basically, could give our solution access to actually clinical data, medical data, EMR data, right? And you imagine, well, now if you have all the prescriptions, you have all the employees on it, you have large scale within an organization, and you have the clinical outcomes that you can show back to the employer, right? That is really the holy grail. So I think there's watch this space. I think there's gonna be a lot of great stuff there. But also what I would say is, it really, I think a lot of this is about the end, right? So part of the reason I think I love this space so much is, there's a couple million people probably in the US on these drugs right now. I don't know, nobody really knows, but there's 100 million probably that could be on the drug, maybe even more than that over time. So there's a big gap between a couple million and 100 million. Now, I think there's I don't believe it's possible to get all the way there with direct to consumer. I think that will get some portion of the way there, but I think really direct to employer is what's going to do most of that lifting. And so you just imagine, organizations that may in a year or two or three have 20%, 30% of their population on these medications, paying a reasonable amount for them, being able to modulate, tune so that the program works for their particular budget and their particular context, and then be able to actually show to their, to their health plans or, to their own internal, self-funded plans that, hey, look what we've done, right? Like, we've just really fundamentally changed the nature of this. And again, if everybody did this, then every employee, even the ones that are transitioning between employers, would have access to these drugs. And that's something we think about too, which is we want to make it so seamless that somebody can leave one Andel enabled employer and go right on to the next one, and actually that can be maybe even navigate and think about, and we show on the app, which are the employers that support Andel right now. So you can use that if you want to factor that into your transition decision, you can do that. I just think there's quite a lot there.
Um, Really quickly, for all of our gym bros out there, I had said how much money employers might be saving on, not managing gym equipment and putting gyms in. I am a ACE certified health coach, and I absolutely encourage all GLP-1 patients to exercise and go to the gym or work out at home. But we can work out at home, right? We can get gym memberships. I think that most patients would prefer to have their medication covered than have access to a gym, to be honest. I think that that would trump everything else.
Yeah,
So,
look, I mean, I think it's sort of like, what do you do first, right? If you can get people to actually start doing the movements reliably, that's the first step. I mean, I'm also, in your, I'm not an instructor, but I'm certainly a fan. And so, yeah, look, you've got to basically get people to the point where they feel comfortable enough to be able to undertake these activities. And oftentimes that means that there's a period of dropping, some weight before they go and take a boxing class or whatever it is. But I think that the two can be highly complementary. And I think, as you said, everybody should be doing as much as possible. And maybe there will be research in the future that says that people who start taking these drugs who did no physical activity before do start overwhelmingly doing that, and that's another accelerant, right, to all of the benefits that you're likely to get, and the employer is likely to get.
well, I know I have seen studies stating that people on these medications are sometimes and pretty frequently getting gym memberships for the first time and
Yeah.
maintaining them longer than and on average. So a lot of people in like the health coach space, were in fitness world, were very concerned that people would just stop working out, but it's actually the opposite. And, like you said, when you drop weight, it's when you drop that inflammation and you
Mhm.
no longer have the joint pain and you have the, mental health benefits and you have the motivation to then start working out and you have the awareness and ability to, you know, focus more on protein and healthy nutrition and movement. All of those benefits come after using the medication.
Mm.
Um, so yeah, I think that this is going to be extremely beneficial for the employees and the employers and the nation. To be honest, I'm really excited to see this grow. And so you're
By the way,
saying,
it's also the world. I mean, I should say that. So, I spent 12 years in London. I believe that this is a global issue, right? Now with MFN and drug pricing being much higher outside the U.S. than it ever was before, people are starting to pay cash for drugs, and employers are starting to look outside the single payer system for solutions. Andor wants to be there to support our pharma company partners and future manufacturing partners as well.
speaking of MFN, can you tell me if this program would be available to employees who are on Medicare or Medicaid?
No, unfortunately, this is not a program for anybody on those programs at this time.
And I know that that's not Andel's fault. That is often just the case for anyone on government insurance. For anyone listening now, unfortunately, that is just the case. Hopefully, the pricing will come down with MFN and patients will be able to get covered through their states. Fingers crossed. We're hoping just next month that we're going to see people getting coverage for the first time.
Well, look, I mean, again, you really said it, right? On the population level scale, when what we do works, what's going to happen is you're going to have a huge percentage of the population that is going to be healthier than they've ever been before. Well, what does that play out in? It plays out in basically the downstream taxpayer dollars to support the population just are less and less and less and less and less. It doesn't just mean people who are, like people get on Medicare from being on employer plans before that. So I think there is definitely a total downstream benefit.
Yeah, absolutely. And just for clarification, you said that you're looking at partnering with employers, even if they are not chipping in, just so that the employee can benefit through the program.
So for our current set of drugs, which is the Lilly QuickPen, there is a contribution requirement. It's not kind of cut and dry, but there is a requirement that the employer does contribute something. This may be different for other drugs in the future, but that's just, we haven't negotiated those deals yet, so we don't know. But for now, if you're an employer hearing this, I would expect that for any of these programs you're likely to see that are direct to employer, they're likely to require some contribution on your part so that you can separate your program from the pure direct to consumer, because that's kind of a separate channel. And I think there is a desire on the pharma manufacturers not to have those blend together inside the employer, where the employer is effectively reselling the direct to consumer price.
Right, right. That makes sense. Um, oh my gosh, this is really exciting. It's super exciting. I know that the Pan Foundation created the very first ever obesity drug prescription assistance program, but it was only for people who had insurance coverage. And a lot of patients were irate about this because they did not have insurance coverage. Like, why would you need to help someone pay for their medication if they've got insurance coverage?
Right.
But what I found is that a lot of people were spending $500 as a copayment. And so this could potentially be within that same realm. It's not more expensive than the average copay for the patient, correct?
I mean, the copay is something that's variable for any different plan. I've seen from $20 to $2,000. I mean, like it can go anywhere, right? That's the problem with these kind of fully funded insurance plans. But what I will say is, I think that GLP-1s are breaking the healthcare system in the most lovely and beautiful way, which is that basically people are now figuring out that actually it doesn't just have to be on insurance to be covered, or to have employer contributions to that. You as an employer can have both a PBM and a parallel path direct to employer provider like Andel, providing different types of service and different types of drugs to you, all under one roof. I think that's probably the way it should be. I just don't think that when we invented the original idea and concept of insurance plans for pharmacy benefits, I think that the world was very different. There weren't all these wonderful, potent, brand drugs out there that solved all these various conditions. Now there are, and I think we're having to contend with a way that everybody can get a fair access to all of these medications without being blocked out by their insurance provider or PBM.
Can you tell me how many employees or employers, sorry, how many companies you have on your program currently? I know you just got started.
Yes. So we just got started this week. So we already have a company, a wonderful company with close to 1,000 employees that we're going to be setting up next month. Just a beautiful, beautiful business. And so very excited to tell you more about that maybe a little bit later. But we are getting, this is not to kind of to brag or anything, but we're not doing any marketing at all. And maybe this is marketing, but it's too much fun to be marketing. And we are getting probably 5 or 10 major leads, RFPs a day. And we've never, we barely can keep up with everything that's coming our way. People are finding us just like you did, I guess. And basically they're thinking, wow, this is so different. And I think what people are seeing, the consultants, the brokers, and the employers is, wow, this company looks like it was exactly what we needed. It's perfect. It's beautiful. And it's only $9.99 per fill. Like that's kind of what we're getting. It's this no brainer. We got to at least take a look at it, right? Relative to other things that are out there.
Yeah, a lot of people are looking for a solution for affordable access. And so I'm not surprised at all. I imagine if you did any marketing that you might regret it because your inbox would be absolutely
Mhm.
flooded. Have you thought about partnering with any nonprofits like the GLP-1 Collective or the Obesity Action Coalition to support patients with education and
They should. I would love to. Absolutely love to. Please, they should all contact me. Absolutely. I would love to do that. I just want to stress again, this concept of being a cooperative runs deep. This is not a pure money-making type business. You'll find it's very different. We have a .org address, which is again very different, signifying how different we are. And also, we have a plan to give 5% of our profits to a fund that will help people who can't afford even our low prices access these medications. So we're very much looking for partners that can help us administer that and help us get the word out about that.
wonderful. I'm so curious if the PAN Foundation would be interested in helping patients cover medication costs through this program. We'll see what comes in the future. I'm excited to find out what's going to happen and hopefully have you on again a year from now and learn all about the success you've had.
I would love to.
There is nothing more important to me than patients who need this medication accessing it in a safe and affordable way. So I appreciate what you're doing, and I am looking forward to finding out how I can help.
Amanda, it's been an absolute pleasure speaking with you today. And I am too. I'm very excited about what's going to happen in the coming year. I think we're going to have a lot of interesting and positive things to report.
I think so too.
Absolutely. Thanks so much, Amanda.
Thank you. If you took nothing else from today's episode, take this. You don't have to wait for your HR department to figure this all out on their own. Go to andel.org right now, click Refer Your Company, and let Andel reach out to them directly. All it takes is 5 minutes, and that is self-advocacy. If you want to stay on top of everything that's happening with the studio, go to glp1studio.com. or find me on Substack. You'll get all of the latest podcast episodes with full article write-ups, advocacy tools, a newsletter, and GLP-1 meetup updates. The link can be found in the show notes. Thank you again for listening. I treasure every single one of you. And don't forget, when you advocate for yourself, you advocate for all of us.